inauguration of this ASG Ophthalmology Hospital. There are many hospitals here, but I think this is unique compared to others, because what I have noticed and seen, you see, you have all facilities under one roof. And what is important again is, I was just reading, you all are going to also take care of poor people. After all, today there are only two priorities in society. First is health, the other thing is education.
It only shows that it's a team of experts, and something that you just mentioned, like what Mr. Sardina said, is about most of the doctors studying in government institutions is the passion that is driving you to bring out these type of centers in different parts of the country. All I can say, Honorable Chief Minister was mentioning that already you have been recognized under the Goa government scheme, also DDSSY. Morning only we were discussing, and Honorable Chief Minister has already given approval for that. But something which draws my attention is the specialities that you're bringing on board. It's very important because many times I was talking to Dr. Ugam also. Many times we have to run out of Goa to different places to take specialty care, and many times it's not affordable for people. Sometimes the accommodation part also, people hesitate to go out of the state of Goa because they don't have somebody there to take care of them. I mean, the state government of Goa, just like you have talked about telemedicine and reaching out through your vision centers to different parts of Goa, I think Chief Minister is also of the opinion is that telemedicine is something in the need of the hour, and through which we can reach out to more number of people and people can be attended to on time. Your hospital will definitely, as mentioned and we were discussing in the morning, will definitely receive support from the government.
First of all, I congratulate the experts team of the doctors who have passed out from the Goa Medical College and others also, who especially come in the Goa to set up this ASG hospital. I think you are across the 36 cities you have established, all the experts people you have. Definitely you have already associated with the government of Goa for the different programs, for the different schemes of under the DDSSY also. In future, we require the super specialty treatment in the eye care, which is already so many people, they are always traveling out of the Goa for the super specialty, especially in the Mumbai and Chennai, I think so. And for that purpose, we are giving the Mediclaim also. I think if you can come under the Mediclaim scheme, then definitely the so many people will save their time and money also. Definitely if they get the super specialty treatment here, then that will be the best for the people of Goa. I think the private players in the healthcare should come in the state of Goa. Definitely when there is an investment from the private sector, it is always good that we are welcoming this type of investment. So jointly the government and the private sector can do better for the people of the Goa. In future also, now you have come in the specialty in the eye care. In future, we are welcoming for the other groups also to come in the state of Goa, and along with the partners, we can do much better for the people of Goa.